Good afternoon, everyone. To our friends and neighbors in our Muslim community, and by the way, we have the second largest Muslim community of any American state, Ramadan Mubarak, Assalamu alaikum. We wish you a blessed, holy, and reflective month of Ramadan. Also, before we begin, I want to give everybody a huge thank you to all the folks who joined us last night for Jersey for Jersey. What a tremendous night. To all the artists and Jersey icons who joined in, to every single one of you who watched and listened, to the heroes, healthcare workers, firefighters, first responders, small business owners who were highlighted, and everybody who was last night together sharing Jersey pride. And I can certainly say for the First Lady, can't thank you enough. Again, to the stars, to the heroes, bless you all. And by the way, the meter is still running, but it raised many millions of dollars for the Pandemic Relief Fund, and that money will be put to good use. As I've said from the very beginning, it will not be without casualty, and we will have the sad task to update that in a minute. That we're going to get through this as one New Jersey family, and last night that family came together as possibly never before. I'm honored to be joined by the woman to my right, who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, another person who needs no introduction, our state's epidemiologist, Dr. Christina Tan. Thank you, ladies. To my immediate left, another guy who needs no introduction, Superintendent of the State Police, Colonel Pat Callahan. We have Jared Maples, Director of the Office of Homeland Security and Preparedness with us. I know Matt Placken, Chief Counsel, will join us in a bit. And joining us today on the far left, another good friend, Dr. Brian L. Strom, Chancellor of Rutgers Biomedical and Health Sciences. As we know, there are tremendous things happening at our state's flagship university, and I am proud to have Brian and his team as part of our army against COVID-19, and we'll get to all of that in a little bit. So Brian, great to have you with us, man. First, as we have been doing of late up front, we will get to our daily discussion of the numbers, as sobering as they may be, and the charts that underpin them. We're announcing 4,427 positive test results, pushing our state total to just under 100,000, 99,989. We should carry the expectation that tomorrow we will exceed 100,000 total positive cases. And remember, I urge each of you to keep in mind that this is a cumulative number, since our first positive case was announced only on March 4th. Of the nearly 100,000 total cases we have reported from then until today, roughly, we know 46,000 of these individuals have now exited the 2-week incubation window. So even as we prepare for tomorrow, let's remember that there are tens of thousands of residents who have received a prior positive test result who have now likely defeated the virus. Sadly, however, we know that there are many who have not. And today we also report 307 additional deaths of precious souls and members of our New Jersey family, meaning that we have now lost a total of 5,368 blessed residents in New Jersey to COVID-19 related complications. We continue to see that the curve of new COVID-19 cases, as you see, remains significantly flat, even with today's slight uptick in cases. And as we map the outbreak across the state, we continue to see a slowing of the rate of spread. Mahan, let's go back to the chart before, though, if we could. Let's just remember one thing, and Judy and Christina can add to this. This is not the denominator. We wish we knew what the denominator was. These are more positive tests, probably specimens, Judy, taken 5 to 7 days ago on average. Thanks to Brian and team, it's a much more rapid return if you're in the Rutgers model, and it's a slower return perhaps in other models. But I don't want folks to confuse the fact that we've got more testing we're now the 4th highest tested state in America, and we may be, frankly, getting close to the 3rd highest tested state in America, considering where we started. which was basically no readiness or preparedness in our country, that's quite a feat, but it still doesn't mean we know what the denominator is. This is just the amount of folks who have tested positive. And maybe if we could now flip to the chart that you were on, and here we go. So the map, as we've seen this before, it measures the outbreak across the state, and we see a slowing of the rate of spread. And you can see this is a meaningful slowing. We changed our color code yesterday because we ran out of runway on light shades. But you've already seen a couple of counties go to over 30 days of doubling. This is the amount of time it takes to double the spread of the virus. So that includes, by the way, my county of Monmouth. Look up at Bergen County, which is where ground zero was, 29 days. So you're starting to see lengthening, and that's because of what you all are doing out there. I'm sure we're helping, but you're all doing the heavy work. You're the ones who are staying away from each other and abiding by social distancing, and because of that, that map shows us enormous progress and encouragement. Again, but at this point, and I'd like to think it's otherwise, but we can't ease up one bit on our social distancing. I am not, and we're not in a position yet to begin reopening our state and jump-starting our economy. I still think that's weeks away. We need to see more progress and more slowing before we can begin those considerations. But stay at it, because you are making a difference, unlike, by the way, in any American state right now, and that is another source of great Jersey pride. In our health care system, as of 10 p.m. last night, there are 7,000, as you can see, 240 residents hospitalized for COVID-19. That is, I think, virtually, Judy, unchanged from the night before. Our field medical stations have patients in total of 91 persons. And if you look at the rate of new hospitalizations, we see an uptick since yesterday, but still below our previous highs. There were 1,990 patients in either critical or intensive care, also virtually unchanged. Notably, ventilator use had a considerable one-day drop to 1,462 currently in use. I think that's the lowest we've been since April 5th, according to our notes. So Judy can give you some color on that. That's a good sign. And for the 24 hours preceding 10 p.m. last night, our hospitals reported 752 total discharges, also equal to new admittances. However, even as we know there are many who are defeating COVID-19, there are many whose battle with the invisible enemy was not successful. I'd like to remember a few of them, if I can, today. First up, Carolyn Martins writes, there with her son, Thomas Martins. We've lost them both. You may have read about them, but today we want to honor them here. They lived in Kearney with Carolyn's husband and Thomas's stepfather, Rudy, with whom I had the honor of speaking this morning, and their daughter, Sharon, who was Thomas's half-sister. Sharon, by the way, is going through what a lot of seniors are going through, and that is facing the end of her college years and a virtual graduation, much to her consternation, as opposed to something physical and in person and celebrating together. Carolyn, bless her soul, a graphic artist who had worked for the Archdiocese of Newark, was the primary caregiver for Thomas, who has Down syndrome. Yet through Carolyn's love and hard work, Thomas was given every possible opportunity to thrive. COVID-19 took Carolyn away from her family at the end of March to her eternal rest at the age of just 55. And a little over a week later, it also took Thomas just as he was turning 30 years old. Rudy called Carolyn, and I'll quote Rudy, her husband, one of the smartest, kindest, gentlest people, and these traits are what helped her give Thomas such a tremendous life too. And Thomas is remembered fondly by so many. We are keeping them, both Carolyn and Thomas, God rest their souls, as well as Rudy and Sharon and their whole family and community in our prayers. Gut heartbreaking right there. Dave Clark, there he is, was a firefighter with the Bayhead Fire Company, where he filled any role that needed to be filled, from chief engineer, looking after the mechanical performance of the company's vehicles, to safety officer. He was a truck driver professionally and took a special interest in following the changes being made in fire truck and emergency equipment designs and builds. He was just 47 years old. And by the way, not just Dave, but his family. This family believes in service to the Bayhead community. Dave's wife, Lisa, who's with him there and with whom I just had the honor of speaking, serves with the Bayhead Fire Police. And son, Zach, is a probationary firefighter and is set to become a full firefighter this month. And I know Dad is looking down with pride. Dave also leaves behind his daughter, and I had a quick word with her as well, bless her, Michaela. Bayhead lost one of its bravest. To Dave, we thank you for your service, and to the entire Clark family, we are with you in prayer and mourning. God bless you all. Pat will know this guy, Rick Vanderklok, 71 years old, of Wayne. Rabbi Kirshner, by the way, of Temple Emmanuel, raised this with me yesterday. Rick grew up, look at that guy, man. Talk about the prototypical New Jersey State Trooper, huh? Looks like he's cut out of granite. Rick grew up in Midland Park in Bergen County and was a member of the 85th class of the New Jersey Police Academy in 1971. He was a trooper for 29 years. He leaves behind his wife of 46 years, Maureen, with whom I had the great honor of speaking. His sons, Rick, who I also spoke with. By the way, Rick tested positive and got his first day back with the Wayne PD tomorrow. His other son, David, who I have not yet spoken with but tried, he retired recently from the West Caldwell Police Department. And by the way, the apple doesn't fall too far from the tree. I mentioned that Rick Sr. grew up in Midland Park, and I believe it's accurate to say that his dad was the police chief in Midland Park. So you talk about a law enforcement families. But God bless Maureen, Rick, David, and their families, including Rick's grandchildren, Julia, Jason, Ava, and Jake, along with his brother Robert and sister Joy and their families. May Rick's memory bring them comfort at this difficult time, and may they also bring them happiness in the times to come. God bless them all, and God bless you, Rick. 4, in fact, more lives among a total of 5,368, which are all worth remembering, and believe me, all of us would like to speak to each and every one of those, and maybe at some point down the road, when the dust settles on this awful thing, we'll be able to do that. To every family who's lost a loved one, our entire state stands with you in support as the great and diverse family we are. Now moving forward. Today with Brian here, I am pleased to announce that because of the new saliva-based training which Rutgers University has developed, next week we will begin testing all residents and staff at each of our 5 state developmental centers. This is a total of more than 5,500 tests, more than 1,200 residents, and in excess of 4,300 members of staff. These are among our most vulnerable residents, and the women and men who provide care for them daily are among our most essential workers. They are dedicated employees who are showing up 24/7 to help care for the adults with intellectual and developmental disabilities who call, by the way, our centers their home. These doctors, nurses, direct care staff, food service providers, housekeeping staff, and many others are doing an extraordinary job and are making a difference in the lives of so many who have no other place to turn, by the way. And our residents, many of whom have called these centers home, literally, Judy, for decades, have faced many challenges in this difficult time, including not being able to visit with family or enjoy their regular outings in the community. Sadly, we have seen this virus in all of our centers, and we owe our residents and staff our best, and testing will help us best serve them. And we are working to expand testing to other state workers and the individuals we serve. These tests would not have been as quickly administered if not for the testing system created by Brian's team at Rutgers University. And it should be noted, this testing system is already going into wide use by our state's largest healthcare systems, at the PBA-sponsored first responder test sites, and soon at many other places statewide. And as I have noted many times, having a robust and greatly expanded testing program in place is vital to our being able to begin to reopen responsibly our state. I said it on Monday, I still believe it today on Thursday, that we need to at least roughly double our testing capacity as a minimal benchmark. Testing will be the starting point, and Judy and Christina have forgotten more about this than I'll ever know, for any contact tracing program that we'll be able to implement, whether it be narrow and localized within our communities or broad-based in partnership with our neighboring states. Without testing, we will not be able to take the necessary steps to contain future cases and prevent them from becoming boomerang outbreaks. Remember again, sufficient, scaled, and rapid return testing, contact tracing, and then a plan for isolation and or quarantining. Those are the essential elements of the healthcare infrastructure that we're going to need before you have the confidence, and we can tell you that we've got the confidence to begin to reopen our state. And we're working as fast as we can, by the way, and all the above. So having an FDA-approved test that can provide us rapid results is critical. And through their saliva-based test system, Rutgers University is in position to help us get there. Moreover, this is a tremendous point of Jersey pride for us all. Our state, after all, is the historic home of innovations, especially in the life sciences. And now we have a huge breakthrough coming from our very own flagship university. To be clear, Rutgers is an invaluable partner among so many in the expansion of testing statewide, and so much is being made possible because of this. And I look forward to this continued partnership. I know Brian will have more to say about this testing system after Judy's remarks, along with other advances being made on the banks of the old Raritan. But right now, to you and all at Rutgers, Brian, I say both thank you, and I look forward to the cooperation to come. And speaking of testing more generally, there are now 86 sites across the state providing COVID-19 testing, including some that are utilizing Rutgers tests. A complete list of the publicly run and community-based sites can be found on our information portal at covid19.nj.gov/testing. And should you believe you need to be tested, your primary care practitioner can direct you to one of the privately run testing sites nearest to you. Switching gears, this morning the Department of Labor reported that an additional 140,000 New Jerseyans filed for unemployment last week, and that $1 billion in unemployment benefits have now been distributed since this emergency began a little more than a month ago. Since March 15th, more than 858,000 New Jerseyans have filed for unemployment benefits. Just to put that in context, folks, 1 year ago, that total number collecting unemployment was less than 10% of that, 84,000. 84,000 a year ago, 858,000 today. The department continues to do everything it can to streamline processes and ensure that all claims are handled quickly. For those of you trying to connect on the phone, we thank you for your continued patience. The department is still dealing with volumes that are, minimally stated, unprecedented. We urge you to go to our online hub again at covid19.nj.gov and search unemployment for answers and additional links to many of your questions regarding things like eligibility, benefits for self-employed workers, how to claim your weekly benefits, and much more. Regardless of when your claim is accepted, I've said this before and I want to repeat it again today, no one will be denied 1 penny of the benefit they deserve. And by the way, if you have lost your job and you can still work, please visit the jobs portal available through covid19.nj.gov, the information hub, which is currently listing more than 66,000 jobs from more than 740 essential employers across the state and across an array of industries. And a reminder that anyone who has left their job voluntarily or who refuses to work at their currently available job is not eligible for unemployment. Now, as we do every day, I'd like to acknowledge some of the really good things going on around our state, whether it be from our corporate citizens or just everyday New Jerseyans. The outpouring of community spirit and support has been critical to sustaining us through this emergency. One of our state's iconic businesses, AT&T and the AT&T Foundation, have partnered with the New Jersey Restaurant and Hospitality Association to provide meals from local restaurants to the healthcare professionals and support staff at our field medical stations in Secaucus and Edison. And AT&T has also stepped forward with critical financial support for the United Way of Essex and West Hudson so they can provide for those in our communities who need a helping hand. So to AT&T and the AT&T Foundation, New Jersey thanks you. I want to also give a shout out to New Jersey-based Premium Nature, and in particular to Shulam Iskowitz and Aaron Stefanski, who came through with a donation of 500 gallons of hand sanitizer to the New Jersey Office of Emergency Management, Pat. This product will soon find its way out of our warehouse into the front lines of our fight against COVID-19. Our dear friend and colleague, second from the left, State Police Chaplain Rabbi Abe Friedman, God bless you, Abe, was there at Division Headquarters in Trenton, and he was joined by your new Chief Chaplain, Reverend John Taylor of Trenton, right here, and State Police personnel to accept this donation and to give Premium Nature our thanks. And now from me and the Colonel, New Jersey, thanks you. And by the way, I'm very gratified to see social distancing going on in that picture, Judy. And once again, to everyone who joined us for Jersey last night, the stars, the first line responders, heroes, the healthcare worker heroes, to the small businesses who were profiled, and community leaders, also heroes, and everybody who played a part in that, as well as the Jersey takeover on HQ Trivia, thank you. Finally, before I turn things over to Judy, I want to return to something that I said yesterday. I spoke about Senate Majority Leader Mitch McConnell's views on state bankruptcy. I used some strong language, which was richly deserved, by the way, but that's because I know how dire this situation is. I have been clear for weeks that if we do not get significant, direct, and flexible financial support from the federal government, we will be forced to make many difficult decisions about programs we all rely upon and which we will lean on in the months ahead. And I know that doesn't just go for New Jersey. It also goes for many of our sister states, red and blue alike. Unfortunately, if it wasn't bad enough yesterday when Senator McConnell was talking about bankruptcies, and by the way, Senator, if you are watching, remember you are from the party of Abraham Lincoln, of Theodore Roosevelt, and Ronald Reagan, three American presidents who, when faced with challenges, found ways to meet those challenges, to be greater than the challenges, to rise up. This isn't about partisanship. This is about America and doing what's right and our values, not just here in New Jersey, but across our country, and looking to history to find role models. What better role model than Abraham Lincoln? What better, who freed the slaves, who kept our country together in Civil War, or Theodore Roosevelt? The environmentalists around this country to this day look to him for leadership. Or George H.W. Bush, the guy who presided this country when the Berlin Wall fell. Those were leaders who met the moment, who got big. They did not get small. They got big in that moment. And that is the challenge, Senator, to you and to all leaders in this country, to find your bigness, to find this moment in time as a chance to stand up and to meet history head on and to do the right thing. So if it was bad enough yesterday talking about bankruptcies, unfortunately we received some additional bad news when the U.S. Treasury Department issued its guidance for how we can use the billions of dollars in funding provided to the state and many of our counties in the CARES Act, which was signed several weeks ago. I have been clear that even this funding, while deeply appreciated, is woefully insufficient to address the scale of the revenue loss that we are experiencing due to our mitigation efforts which are working, by the way, and are saving lives. I was assured that this funding would be able to be used flexibly by states, filling holes that we now must deal with. Those assurances apparently were empty. Treasury's guidance renders much of this funding literally unusable, and without additional flexibility will mean that we will likely not only not be able to use it, but we'll have to return a good chunk of it to the federal government. Let me explain, in case you're wondering, what this means. Unlike the federal government, we can't print money, by the way. The federal government can also run trillion-dollar deficits every single year. New Jersey can't. By the way, just like New Jersey's families, I might add, have to budget based on certain income and certain expenses. And for the past 2 years, we have done something unique for New Jersey. We actually put some money away for a rainy day. When we close our economy, as we have had to do to crack the back of this virus and to slow its spread and to save lives, that income goes away. If the federal government doesn't do its job and support New Jersey's families, we may not be able to keep our teachers, cops, firefighters, and paramedics employed. The very people who are on the front lines every day. And we'll have to send this money back to Washington. Sadly, the message from Washington to our first responders and to our educators and to others on the front lines is clear. As you work tirelessly to stop this pandemic, to keep people safe, our national leadership thinks you are not essential, and in fact that you should fear for your jobs. And again, I was reminded by someone yesterday, whenever anything goes into bankruptcy or there's a financial catastrophe, the people who pay the biggest price are our seniors. Think about that as well. So again, clear, $1.8 billion from the CARES Act several weeks ago. We're happy for it, but it was never enough to begin with. But at the very least, we should be able to support our people and help keep the funding that municipalities and school districts are expecting to stay whole. I and my staff have already reached out to Senate Democratic leaders Chuck Schumer's office. I spoke with Speaker Pelosi last night. We've been on with their respective staffs. We will not relent until the federal government provides the support we need to protect the services that millions of residents rely upon. And remember this, I and we will never stop fighting for you. We will fight this to the death. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. Epidemiologists and chronic disease experts tell us that those with underlying conditions such as obesity, diabetes, and high blood pressure are at greater risk for more serious complications and deaths from diseases like the flu, and New Jersey mirrors national statistics on this issue. A recent study of New York City patients with COVID-19 that was published in the Journal of the American Medical Association provides further evidence of this elevated risk. The study examined 5,700 patients hospitalized with COVID-19 in New York. The most common comorbidities among these individuals were hypertension, 56.6%, obesity, 41.7%, and diabetes, 33.8%. Of the patients who died, those with diabetes were more likely to have received invasive mechanical ventilation or care in the ICU compared to those who do not have diabetes. Of our COVID-19 deaths, the breakdown of underlying conditions is as follows. Heart disease, 60%. 42% had diabetes. 20% had chronic lung disease, such as asthma, emphysema, chronic obstructive lung disease, 16% chronic renal disease, 15% neurological disability, 11% had cancer, and 31% had other chronic diseases. Given this greater risk of severe illness and death, the Department of Health is recommending that all individuals who have even mild symptoms that could be associated with COVID-19, such as fever, cough, tightening in the chest, call your doctor and get tested, especially if you have underlying conditions. Today we report 7,240 hospitalizations last night, basically flat over the last 2 days. There are 1,990 individuals in critical care, of which 73% are on ventilators, which is much lower than we have seen previously. I know there is a request for hospital discharge data by location. We are still looking into that, and as soon as we can get that from the discharge data set, we will share that with you. Today we are reporting 4,247 new cases for a total of 99,989 positive cases in the state. And sadly, 307 new deaths have been reported to the department. The breakdown of deaths by race and ethnicity is as follows. White, non-Hispanic, 53.6%. Black, non-Hispanic, 20%. Hispanic, 16%. Asian, non-Hispanic, 5.4%. And other non-Hispanic, 5%. Today, the veteran homes are reporting 5 additional deaths associated with COVID-19. We also are receiving reconciled data from our long-term care facilities. And we are also starting to look at death certificates to reconcile individuals who have died with a primary diagnosis of COVID-19 and or a secondary diagnosis associated with COVID-19. We do expect that you will see on our dashboard an increase in the number of deaths because we are including probable mortalities from COVID-19. As you know, across many other states and certainly in New Jersey, our long-term care facilities are reporting cases and deaths. There are 446 long-term care facilities in the state right now that are reporting COVID-19 cases for a total of 13,769 cases. In collaboration with Cooper University Health System, we started yesterday testing 3,000 long-term care residents and staff at 16 long-term care facilities in the southern part of the state. Our goal is to contain the spread of COVID-19 among these facilities in the southern part of the state that is not experiencing as many cases compared to the northern regions and where we see a possibility to actually decrease the spread and save lives. In terms of lab reports, according to the data from this morning, of 7 labs sending us COVID-19 results, 179,717 individuals were tested, 79,558 are reported as positive for a positivity rate of 44.27%. So I want to mention our call center again for individuals looking for COVID-19 information. As you know, the state, working along with New Jersey Poison Information Center, established a dedicated coronavirus hotline in January, reachable at 1-800-962-1253. Since that time, trained health professionals have taken more than 25,000 calls. Additionally, NJ211 has answered more than 15,000 calls from residents seeking general information. These continue to be excellent resources for information on the virus and the state's response. As always, I thank you for staying home and maintaining social distancing. Stay connected, stay safe, and stay healthy. Thank you.
Judy, thank you for that update and for everything. counties, just briefly, the same 6 counties continue to be the leading locations for positive results, and that's in order: Bergen, Hudson, Essex, Union, Passaic, and Middlesex, and that's the 6 that we've had. But remind everybody, every one of our 21 counties has both positives and, sadly, fatalities. So this is a statewide all-hands moment. Thank you, Judy. I mentioned him earlier, and I'm going to ask him to say a few words, but Brian Strom is an outstanding leader as chancellor, one of the chancellors at Rutgers, and in his case, in overseeing the biomedical and health sciences. He's a guy I've gotten to know over the past few years, and he and his team, as we've mentioned many times in these briefings, and we mentioned earlier in our remarks, have been leading a pioneering saliva test-based COVID-19 test protocol. And by the way, we know this for a fact, including from the White House, that the Rutgers test protocol is being held up as a model, not just in our state, but nationally. And so with that, Brian, it is great to have you with us. Please help me welcome Dr. Brian L. Strom. Brian?
Thank you. First, I'd like to begin thanking the governor and the health commissioner for guiding the state through this worst pandemic in the century. They've done a magnificent job, ranging from the supervising and assisting in the enormous surge in the capacity of our hospitals to be able to handle this crisis, leading the public through the difficult but critically needed social distancing and near lockdown. We would not be doing anywhere near as well. The curve has flattened, as you've seen, now coming to a plateau, and we wouldn't be doing anywhere nearly as well without their expert leadership. Second, I want to just point out that the citizens of New Jersey can be proud of their state university. We've been tracking and anticipating this epidemic since early January when it became apparent. We invoked our Emergency Operations Center in late February. Tremendous partner in the expanding of testing statewide. I'll give you some examples. And indeed, all the expansion I'll talk about is in partnership with the state. The first FDA-approved point-of-care test was developed in Newark, New Jersey Medical School. This test Hospital in Newark, New Jersey Medical School, RWJ Barnabas Health, Hackensack Meridian System, Atlantic Health System, and lots of individual hospitals throughout the state. Even a few days, certainly not a week or 10 days as used to be the case. This test will be key as we reopen our research labs and eventually our classrooms at Rutgers, and certainly for many other uses as well throughout the state. In addition, Rutgers, New Brunswick developed high-throughput testing for the virus, which gives results in 24 to 48 hours. Widely used across the state, and more recently now tested it as a saliva-based test, as the governor had mentioned. Again, based on this same high-throughput testing developed at Rutgers, New Brunswick. Indeed, a paper just came out yesterday from Yale showing that the saliva-based test actually looks like it performs better than the normal testing. This approach, collecting the samples by saliva, decreases exposure to healthcare professionals, increases collection throughput, how quickly you can collect the specimens, quadrupling it, decreases the use of PPEs that people have heard a lot about the shortages during collection by 90% because you don't need the PPEs in order to be able to collect the specimens, and eliminates the need for swabs and viral transport media, which are the key rate-limiting steps for most tests right now. Early in the epidemic, the rate-limiting step was lack of test kits. Now there are plenty of test kits, but the reason most states can't do enough testing is because they don't have enough swabs. It was piloted last week in drive-through testing in Middlesex County. Right now, it's being used live in drive-throughs in Edison, South Brunswick, in PBA, Police Benefits Benevolent Association, testing sites in the American Dream Mall, Somerset, and Deptford. It's being used with Newark first responders. It's being used in Edison municipalities and Somerset, Hunterdon counties drive-ins, drive-ups. Imminent, meaning in the next week, we will launch the testing that the governor mentioned in the 5 state developmental centers. Friday, tomorrow, we will begin to test everybody at Robert Wood Johnson University Hospital. All of the healthcare workers, it doesn't matter whether they're employed by RWJ, by Rutgers, or private physicians, it doesn't matter. As we begin to plan for the ability of the healthcare enterprise in the state to begin to take care of non-COVID patients again, we need to make sure that we don't give COVID to the patients that we're taking care of. Walk-ups will open next week in New Brunswick and in Perth Amboy. Camden County employees and 31 or more long-term care facilities in Camden County will start within the next 2 weeks. We're also working with Mayor Baraka on testing for 100,000 residents of Newark as part of a comprehensive plan we're working on to enable them to help Newark reemerge from this terrible epidemic. And many, many more initiatives are underway. With this new testing, we can test 10,000 people a day, and it is expandable in a modular fashion at an additional 10,000 people a day for a second module and yet a third.
Brian, thank you. I noted Yale is in your background, so I wasn't surprised that Yale put a paper out yesterday that validated, but so all kidding aside, just absolutely extraordinary work And if things continue to go well, Rutgers alone could be the source of a lot of our salvation in terms of the testing we're going to need to have the confidence to reopen. Brian, let me ask you before we turn to Pat, what's your most limiting factor right now? Is it raw material? Is it manpower? Is it innovation? What limits you from going from that 10,000 module, I'm just making this up to 50,000 or 100,000?
In many ways, there is no limit. It's just, this is all so new. We're just launching it. Right now we can go from 10,000. We can, with new equipment, which isn't all that expensive, we could double it. With another module of that, we can double that. Probably the rate limiting step is the manpower, the technicians to be able to man it. And so we already actually have ordered the equipment for the second module, and we're looking for the 20 or 30 technicians we need to man it. So this can be expanded in a modular way, incredibly powerfully.
And the equipment is gettable? In other words, this is unlike some of the other missions that we've been on where it's elusive. This is very much gettable? This is
gettable. Key is we don't need the swabs. We don't need the viral media,
yep,
which are what is in short supply. So the equipment is gettable. It's not a rate limiting step.
And the manpower, Brian, just for everyone's benefit, is that front end manpower or folks at the back end processing the tests?
People processing the test. Ultimately, what we also need is, because we provide the labs, we need front end people to be able to register people, collect the specimens, do everything needed there. We need further back end people to be able to record the results, report the results to the state, to the
yep,
patient, and so on. So we come in with the lab. There's a front and back end that needs to be added to each use, to each application.
And one more, the saliva test, again, for folks watching, turnaround till you know whether you're positive or not is how long?
24 to 48 hours.
And do you see that potentially shrinking?
Not a lot. It takes that long. Some of it is getting the saliva to Piscataway, and then it's run in a batch in Piscataway, and then getting the reports back to people. So when you need an answer right away, you want to use the point-of-care test. That you have 48 hours. And Governor, you're asking a very important question. As the state develops an appropriate testing strategy, you want to use both of them in different ways.
The point of care is viral based as opposed to saliva.
Correct. Point of care uses nasopharyngeal swabs.
Right.
We are testing that for saliva also,
yep,
but so far that testing is not.
Clearly, if I was going to ask you that, you took the words out of my mouth. Clearly, if that worked for saliva, you've then got a very quick turnaround, and exactly, so it's a game changer at that point.
Yeah.
Extraordinary work. I mean, sometimes, I would say many times, our nose is pressed too close to the glass to remind ourselves how extraordinary our state is and how extraordinary Rutgers is, because the conversation that we're having right now, and I think Judy and Christina will attest to it, is not a conversation that is happening in many places around the country, if not around the world. And that's thanks enormously to our leadership and in specific to our flagship university. Brian, thank you for that. I suspect folks will have questions for you. With that, before we turn to questions, and we'll start over here with Matt, but if I could ask, and I know we've got, I should say this, for those of you watching the live stream, we've had some technical challenges. Are they behind us at this point? Not yet, but we're endeavoring to prove that we are the state of innovation and we can figure out the live stream. And secondly, we do have an unusual VTC with the White House tomorrow. They've typically been Mondays and then occasionally Thursdays. Tomorrow, I'm not sure why. I assume it's the schedule of the president and vice president, but we have one tomorrow. So we're going to gather tomorrow at 3 p.m. Is that correct? 3 p.m. here tomorrow, unless you're here. Otherwise, we'll be together again Saturday back to our usual 1 o'clock time. So before we do, any questions, Colonel Callahan, any updates on compliance, PPE, capacities, or other matters? Thank you.
Thank you, Governor. Relatively quiet overnight. I'll go through it briefly. In Newark, 57 EO violations were issued, as well as 2 businesses were closed. In Cinnaminson, police responded to a gathering on the banks
2,000 in ICU beds, 1,400 or 1,500 ventilators in use, 307 lost lives. We're just not out of the woods yet. But we do want to share with you at least the principles that will guide us, and we'll do that soon. Listen, I'll be the happiest guy in New Jersey, maybe America, if we can have some semblance of normal on the Jersey Shore. And Memorial Day weekend is maybe literally my favorite weekend of the year because as governor, I go around not just the shore, but I had committed this year to do some lake visits and to sort of celebrate the opening. And you know, even if we're back on our feet, I'm not sure by Memorial Day, but whenever it is, it's going to be a new normal. We're not going to be packed in with each other anytime soon. So even if we are able to achieve some success, it's going to be a different kind of success than we're used to in the past. Judy, anything on either Andover specifically or nursing home inspections generally?
On Andover, I know that CMS has finished their survey, and you'll have to check their site for when they finish their report and post it. Overall, we've done over 30 surveys since last Friday. Could be as high as 32. They're out again today. 5 or 6 additional will be surveyed today. We look at the statistics, prioritize where we're going to go, and then we also respond to any incoming that we get, any emails and complaints from on our complaint hotline that don't seem to look similar to the information that we have.
To the other thing that Judy has said, this is very manpower intensive. You've got to be qualified, and it's heavy PPE laden as well, and those are all realities. So thank you for that. I'm Matt Plack, and I introduced you in absentia. I want to make sure you knew that as our chief counsel. Elise, please.
Good afternoon.
Good afternoon.
The first question is from Nikita at NJ Globe. Nikita asks, a few weeks ago, the governor said he had not yet had discussions with legislative leadership about fast-tracking marijuana legalization to secure a revenue source for New Jersey. Have there been any discussions since then? And my question is, regarding the Rutgers tests, when do you expect to hit 10,000 a day? Could we reach a point where we don't need the swab tests at all and the Rutgers developed tests become the standard in New Jersey and elsewhere? And at the same time that the Rutgers tests are expanding in use, are you continuing to ask the federal government for test kits?
Let me say a couple things, and then, Brian, I'll turn it over to you. To Nikita, no, we've not had, Matt, to the best of my knowledge, we've not had any discussions on fast-tracking weed legalization. And I when can you hit 10,000? Can it be a standard not just in New Jersey, but beyond? I think it can be. Certainly in New Jersey, I think it can be. I've already mentioned the White House in particular is regularly discussing the Rutgers. The president himself discussed it. And I would say this, and Brian won't be upset if I say this, and I know Judy will agree, we're not shutting down any avenues on testing, including continuing to pursue other sources of either materials or other testing regimes. I think everybody in this right now realizes the more, the faster we can get this scaled, it behooves us to continue to pursue every avenue available. But now that I've said that, the record will be corrected by Brian. How fast can you get to 10,000 a day? Will there be a moment when you don't need the swab tests at all, and any other color around that?
Sure, I have a pleasure. Firstly, I should particularly point out, I'm a physician, I'm an epidemiologist, I'm not a lab guy. So I don't want to claim credit for these tests, they're not my doing. David Alond at New Jersey Medical School developed the point-of-care test and is fantastic. And also fantastic, Jay Tishfield and Andy Brook, who are RUCDR, that are part of Rutgers, New Brunswick, and the School of Arts and Sciences. Those are very different tests, so and used very differently. So going specifically to your question, I think I would guess, I'd have to check with the RUCDR people to be sure, but I would guess they'll be at their 10,000 within a week or two, which is part of the reason they've ordered the equipment for the next module going forward. But I don't think we'll ever probably do away with the swabs, certainly not right now, because you need the swabs at least for the point-of-care test. So unless the point-of-care test is able to prove it can do as good a job as the saliva test, you'll always need for rapid response, immediate response for clinical use, or as we plan an economic reentry, for example, if you want to test people who are there now to find out, can they go to work today? Are they infected? Because this test today, if you're not infected today, you could be infected tomorrow. So you need the answers real time in order to know that. Ultimately, there'll be antibody tests available, and again, as I briefly mentioned, we're working on that too. Antibody test will give a totally different kind of information. So these give different kinds of information. The saliva test does look like it is better than as a sampling than the nose and mouth sampling. If we can do that with the point-of-care test as well, that would be fantastic. But that has not been proven yet.
That will be a huge welcome relief to those who have had to go through the process of getting that thing stuck up their nose into their front lobe of their brain. By the way, I'm told that our team has channeled the spirit of Thomas Edison, and the live stream is back to normal. So thank you all. Elise had a quick follow-up, Dante.
So when we talk about the Rutgers tests, are you typically talking about the saliva test or the point-of-care test?
I have been referring to the one that's the most scalable. That's my answer. So the one that is 10,000, and you can go to another module. I think what you're hearing, and Brian, tell me if I'm getting this right, that's eminently doable. The only challenge is that there is that 24 to 48 hour lag. The viral test at the point of care is more invasive, more heavily reliant on a healthcare worker and PPE, Judy, if I've got that right. But you get the turnaround within 40 minutes, and I think I'm hearing you say, you're not promising anything, but it's possible you could get a point of care at the point of attack saliva test that's potentially developed sooner than later.
Correct. That's exactly right.
You got, guys, either of you? Cameras? No?
Right.
You good?
I'm with that.
Ma'am.
Hi. Question on testing. How many of these saliva tests have been processed so far? And can you speak to the accuracy of the saliva tests that we know of? And who is deciding who gets these saliva tests, where they're being used? And Governor, question for you. Earlier this week, Governor Wolf in Pennsylvania rolled out a reopening plan in phases with the colors red, yellow, and green. Can you speak to when you may roll out your plan, if it will be similar to Pennsylvania's, and if you are consulting or how the state's governors are consulting when these plans are being formulated?
Is that it? Thank you. Brian, you want to start? Just look at how many so far, what's the accuracy, and who gets them so far, at least.
Sure. So the number so far, I'd have to ask the RUCDR people and Andy Brooks to be sure, but certainly it's in the thousands. It wouldn't surprise me if it has exceeded 10,000. Again, we just began the pilot with it last week, and it's very rapidly being geared up. Accuracy compared to the saliva test, compared to the oropharyngeo swab test in the same people, it is 100% accurate. In fact, based on the Yale data, it suggested maybe better than 100% accurate. And the reason for that is, right now the traditional test, where you take the swab from deep in the nose and deep in the mouth, which is hard on the patient as well as hard on everybody else, it has a sensitivity of about 70%. So it misses about 30% of cases. And at least some of that is due to sampling. Because if you don't go in far enough or you don't make the patient uncomfortable enough in the process, you're going to miss things. Saliva test, you don't have to do that. All you need is half a cc of saliva, spit into a cup, special cup, but spit into a cup. And so it automatically is sampling, so it's at least as good as the traditional tests, traditional sampling, and quite likely even better. Who gets it? Right now it has been a series of rate limiting step. Hasn't been numbers. It's really been a gearing up, and basically we've been looking to the state. We've been looking to other sources for who are the first people to get it. We are gearing up more, anticipating the use will be more. So it's really the biggest determinant of who's getting it now. Again, All tests in the state require physician prescription. Those are department state rules, but we want to follow the state. We want to be cooperative. We want to be helpful. You know, Judy and I have talked multiple times on the phone of how can we be of help. We're not dictating this. We're looking for direction from the state. I think going forward, what's key is as the state, you know, testing is absolutely critical to emerging from the economy, economically, but it's not going to determine it. The testing ultimately should be used in partnership with the broader state plan, and the testing should fill in as part of the enabling the state plan.
I would just add a quick comment on who gets it, and then to answer your question about what it will look like, the plan to reopen. You know, I think it's fair to say, and Judy and can also weigh in here, Brian, it's been a little bit deliberately a patchwork quilt. So, for instance, I mentioned probably 2 weeks ago at this point, there was a so-called pilot in partnership with Middlesex County in Edison. That was the first time I think we spoke about the test being out there. You heard the PBA site at American Dream. You heard Somerset and Hunterdon counties combined energies. I said today, with our direct involvement from the woman to my right, as well as Carol Johnson, our Human Services Commissioner, the 5 state developmental centers that Rutgers is now going to test. So there's been a little bit of, again, we're cobbling. Remember, just step back, everybody who's watching, and to your question, we started as a nation completely and utterly unprepared. Maybe you could say that period, and we'll leave that to the historians, but specifically in testing, it's been cobbling together at every step of the way, from our FEMA partnerships to now Rutgers and everything in between, and the 86 sites, I think we had said. So I only say that to distinguish between what has happened and what will happen. And we have not yet come to the conclusion of what exactly our capabilities are and what the will look like. And we're going to be pulled. You've got developmental centers, which are not centers. It's an awful word, actually, to use that, right? These are homes. And I mentioned this in some cases for people for decades. So you're going to have specific communities that are going to be a big pull. But you're also going to have, as Christina has forgot more about this than I'll ever know for sure, you're going to have the requirements to have sort of the statistically significant broad population testing that we're going to need to have the confidence to be able to, not just for us, but to you all, to have in place before we reopen. We have promised a couple of days ago that we would outline broad principles this week. I still hope to either tomorrow or Saturday, but it will be in the next number of days. It will not have time frames associated with it, at least not that I can anticipate. But we do owe folks the broad principles of what we're looking for in order to give us the confidence that we can begin to move to that phase. I can't tell you at this point whether our color scheme will be the same as Pennsylvania's, but the notion of something like that is broadly similar to what we're thinking about. So thank you. Ian, to you. Thank you.
Governor, an immigrants' rights group issued a report today detailing numerous health and financial problems undocumented immigrants are facing in the state. They're asking for $600 a week in payments to those who have lost wages. Is that something you might do? They're also calling for expanded access to health care. We've heard about people being sent home from hospitals and being unable to get tested due to lack of insurance. Is there more that we as New Jersey can do to ensure the undocumented can get tested and get care? You've mentioned the state is working on preventing widespread outbreaks of the coronavirus at long-term care facilities in the state's southern region that haven't yet been impacted. Can you give any more details on that? And finally, is there any guidance yet on Memorial Day parades, which are such an important part of the fabric of many of our communities? Thank you.
Thank you. There's no guidance on Memorial Day parades, but I have to say, with a heavy heart, I'll be very surprised if we have a typical Memorial Day parade anywhere in the state. I hope I'm wrong about that, but again, as I said about graduations, and please God, I hope I'm wrong about that. Don't put down any non-refundable deposits on either of those. I did not see the immigrant rights group's report. I'm open-minded to the $600 a week under the theory, as I've already mentioned quite clearly, we're running out of money. but we want to not just bring, as I've said this, not just because I think we're good guys and gals, but because we're not going to break the back of this virus unless we bring us all along. I had a long interview earlier about our prison population, another specific community. So open-minded, but I can't say that I commit to it. I've not seen the reports, so bear with us on that. And access to health care. Judy and I have been pretty clear about this, right? Nobody should be denied access to health care. So if that's happening, we need to know about it. And I would think that the best place to go is covid19.nj.gov. Judy, anything you else want to add to the sort of comprehensive testing, to any of that, by the way, but also to the comprehensive testing in the southern long-term care facilities?
Yeah, first on the any denial of health care, as the governor said, we should know about that. When we have a hotline, a complaint hotline at the New Jersey Department of Health. Feel free to use it. You should not be going to your emergency room just to request a test. They are not testing centers. There are 80 testing centers. Every county now has one, and you should be able to go and get tested if you are having symptoms. It's still for symptomatic individuals. But if you're not feeling well, and if you have no insurance or you're undocumented, we have federally qualified healthcare centers. You should be calling them and going to your FQHCs. And we have many throughout the state. So I just wanted to make sure people understood that. As far as long-term care in the South, what we've done is we have a full line listing of every long-term care facility and how many cases they have. And it's obvious to us in the South that if we get in there sooner and test everyone, both employees and residents, we will be able to contain the spread that we've experienced in the northern and central part of the states. So that was chosen specifically to focus on a specific group of long-term care facilities that have very little spread, 1 or 2 cases, and we'll see how that comes out. We should have results next week.
Mahan is in my ear and wants me to clarify to your question, and I think, Matt, you asked it originally a number of days ago. We're more likely to be talking about our rolling plan on Monday than it is tomorrow or Saturday. So, and the reason for that is a little bit, I'm going to harken back to the example of closing schools. We don't want to just pound our chest and say, hey, we close schools. We want to make sure whatever we give you is right and that we have deep conviction about it. And again, these are principles, but we want to make sure that we're committed to them and you hold us to them in the absence of any other major shift in the sands here. And I hope any shifts we have are positive ones. But for the meantime, everybody, please continue to do what you're doing. We're doing an incredible job as a state. Stay home, stay away from each other. And with that, that's the best thing we can be doing right now to get back on our feet. But it looks like Monday we'll be with you with the broad principles. Dave, good to see you.
Good to see you, Governor. You've talked a little bit about this moving from day to day, but could you just give us a sense, what kind of a job do you think our first responders, healthcare workers, supermarket workers are doing in the COVID-19 reality that we're now all in? We've talked a lot about the problem with PPE. Are we at least now at the point where all of our healthcare workers have the protective equipment they need, or is this still a challenge? Where are we at with that? On the CARES funding restrictions that you were talking about in your opening remarks, what specifically were you going to use the money that you thought you were going to have to do? And now, according to what they're saying right now, what will you not be able to do? What would we, not you, but what will we as a state not be able to do? And finally, and most importantly, it seems this saliva test, which we were calling a spit test, but now it's a saliva test.
Use the proper
a little bit, yes, it elevates it a bit.
Here.
This seems huge. 10,000 next week? I mean, I know Elise asked, when are we going to reach 10,000? You said next week. When are we going to reach 100,000? So presumably we could do mass testing. I know Dr. Tan a couple of days ago said, well, on the 15 to 20,000 test, why is that? And she said it's not a magic number, but we
Yep.
do what we can do, we work with what we have, it would seem that this could be huge in terms of getting a broad element of testing in New Jersey.
Yeah. So may I just give a couple of quick thoughts, and then I suspect there are several up here who may want to respond to this, including not just Brian, but Christina and Judy as well. And Pat, you may want to help me on the first one. First responders, I think healthcare workers, first responders, what is the, how do we rate the job they're doing? A++++. I'll tell you, I don't know about you, if you watched this show last night, a couple of times I actually had to get up and leave the room. Pat and I were texting back and forth. It was so emotional. These folks, I mean, the stories just in that 1 hour last night, including not just healthcare workers, but certainly healthcare workers and guys like Eddie Donnelly, our friend, and other police and fire and first responders, but the small businesses, the small businessman early in that program talking about just making meals for people who didn't have anywhere else to turn, the retail workers, the NJ Transit, bus and rail, the longshoremen, the warehouse, A++++. I don't know there's any state in America that's had the heroism that we've had. Secondly, are we, I'll use this as the visual, are we like this on PPE for all of the above? No way. No way. I was on with a leading light of New Jersey yesterday who was asked to come to me on behalf of a particular healthcare community. And we've done a lot for this community, but they are perpetually running short. And even if we were batting 1,000 with healthcare workers, Judy, and Pat, and first responders, you got to then go, there's always going to be another ring you got to get to. Warehouses, essential retail, longshore men and women, etc. But A+++ on the job they're doing, the evidence is overwhelming, including many, sadly, who have paid with their lives. We've made a lot of progress on PPE, particularly, this is a little bit like testing. We were not in this business 7 or 8 weeks ago, and Pat mentioned that we've distributed, I don't know how many millions of, double-digit millions of pieces of this stuff. I still spend a good piece of each day calling far-off places in the world to try to get PPE. But Pat, anything you want to add on particularly on the PPE front?
It really is almost an hourly conversation. 5 minutes before I walked in, I was on with Commissioner Hicks trying to secure 40 to 50,000 cloth masks for inmates so they could be laundered. Our hospitals and long-term care. It is. We're not in a position that we could just stop, whether that's isolation gowns, which are at a premium now, N95s, that decontamination system is going to be huge, and I hope the other two come soon. So I can't envision stopping to trying to procure PPE. I don't know when that'll be, but I hope it's soon, but I don't envision it to be.
And we've mentioned this over the past couple of days, whether it was touring Atlantic City, Field Medical Station, or East Orange and Paramus yesterday, we're not only playing for the game that we're in right now, we're also playing as much as we can for the next game that's going to be upon us, and that is whatever spike. Again, we've said this, I think it's fair to say, even if we do everything right, this is the sort of virus that comes back on you. So I am... may I say one thing Brian mentioned earlier, the 70% hit rate? I won't say who it is, but a member of our team had not one but 2 consecutive inconclusive tests, to your point. And I meant to say that earlier. Christina and Brian should weigh in here as well, but I am not, I feel like an epidemiologist in training some days, but I'm not an epidemiologist. I don't want anyone here to confuse my personal background or qualifications. How big a game changer is this in your opinion? And not just the 10,000, but if you hear Brian say it could be 10,000 and then another module to 20, and then with some manpower and buying the right equipment, which sounds like it's achievable in both cases, that could get even higher and higher. How do you react to that?
Definitely, with any sort of new advances in testing and anything to, for example, decrease turnaround time as well as to be less invasive, these are all characteristics of the tests themselves that will help improve whatever testing strategy that we put forward, as we move forward to trying to still, improve the access to testing in terms of like targeting, our vulnerable and priority populations as well. So it's definitely going to be a game changer. Unfortunately, I think, it really kind of depends. It's hard to provide a specific answer at this point about like what that impact might necessarily be.
Thank you for that. Brian, maybe also Christina on this one, and Judy. How big, I know your nose is pressed to the glass because it's you guys who are doing it. So how big a game changer do you think it is? And incrementally, how big a game changer would be the saliva test point of care that has the rapid turnaround that the viral currently has?
So I'd like to respond to a few of the comments, and of course the governor's as well. Firstly, as a quip, as an epidemiologist, in fact, as well, at least people know we're not skin doctors now. You asked about healthcare workers and how people are doing. I think I can safely say, through the efforts of our healthcare workers, through the efforts of the governor, through the efforts of the health commissioner, that there is no one in New Jersey who has died due to lack of a hospital bed, due to lack of an ICU bed, due to lack of a ventilator. And in fact, I know of no circumstance where we've even had to put 2 people on a single ventilator, as happened in New York. We've never been in a situation where we have to make choices of taking someone off a ventilator to have the ventilator for somebody else. So the surge has worked incredibly well. People are working day and night. People are risking their lives. There are healthcare workers who have died. Again, they're afraid to come back to the family, but it is working. And again, as I began with, we really owe enormous thanks to the governor and the health commissioner for making this feasible. In terms of PPEs, it is day-to-day. Just in the healthcare environment, it is day-to-day. We've mobilized our engineering department in the university to help manufacture on 3D printers. Now gowns are exactly as you said, are the shortage. So we have enough, barely, but it's really very much a day-to-day thing. And ultimately, as the governor said, ultimately you want to go way beyond day-to-day. You want to be able to store up to be able to have for the next time. 10,000, keep in mind, I'm talking about 10,000 a day, not 10,000 eventually. So it will make a big difference. But I think it's important to realize there's 2 advances there. One is the large volume per se, and the other is the ability to do that in saliva. There are lots of places around the country that have tried to do that and haven't yet succeeded. Our RUCDR, the lab involved, is in discussions with the FDA and with the White House almost every day, and have offered technical assistance because other places in the country haven't been able to set it up successfully. We've been able to set it up successfully, prove that it works. FDA is comfortable with it. Everybody is comfortable. We can expand it here, and we want to be able to export it to other states to be able to use as well, because it will be just as important to use elsewhere. But we want to reserve our capacity for New Jersey and to be able to help the state. The other thing, by the way, just going back to the PPEs, is we're also doing decontamination both in our hospitals and our labs. I mean, it's at that level. We haven't run out, but it's that level of tightness. And I avoided answering the governor's question about how big a breakthrough it is.
That's a big deal, isn't it?
Yeah.
Would you have the same turnaround as you do with the viral?
The 24, 48 hours. Well, certainly, if we had the saliva test for the point of care test, it would still be 40 minutes the same way. I mean, it's really a question of testing whether if you take it from
that to me
saliva.
is a big deal.
Yep.
Real quick, Dave.
Real quick, is it possible by midsummer mass testing in New Jersey, or is that a dream? A significant chunk of the population.
I'll take one for the team here. I think it's too early to tell, and it also depends on what you mean by mass testing. But the important point Brian just said was 10,000 tests a day, and that's a pretty good start. That's 140K a week, which is probably still not where we need to be, according to the experts, but it's a step in the right direction. So it feels to me like the curve, Dave, again, there's two non-medical guys here, unless there's something about you I don't know. The curve feels pretty steep right now of innovation. And please, John, you'll close us out.
Yeah, I have a couple from Daniel Munoz of NJ Biz first.
Is he okay, by the way?
I don't know.
Okay.
I don't.
Could somebody mind, can you reach out to him? Thank you. Go ahead.
Governor, you mentioned there's upwards of $1.8 billion of federal aid the state can't use because of Treasury's new regulations. What regulations exactly are tying the state's hands, and how much of the federal aid can the state still use even with these new guidelines? And then others, on Lakewood, there have been 2 raids in Lakewood. Can you speak to any specifics about what you're seeing there, specifically a company that may have had ventilators in a warehouse and another company that was involved in possible hoarding and price gouging? Have you gotten any reports independently of those kinds of activities out of Lakewood with those specific companies? And the Rutgers test, I know you've addressed a little bit of this, but is it play into your, at what point will asymptomatic people be able to go and get tests to help with that reentry? And Governor, you've talked about these doubling rates, you've shown the maps, you've shown the flattening of the curve, and earlier this week you used the phrase relative stability, but that still means there's a significant number of cases, a number of people dying and becoming ill under that flattened curve. Do you think, is there a concern on your part that people will see that and back off and start chafing at some of the restrictions and think, okay, the curve's flattened, we can dial it back now and go outside, go to parks? And any thought to that?
I'm going to ask Matt to come here in a second. I will just quickly on the Lakewood, and Pat may want to come in behind me on this one. Because it looks like it's a law enforcement matter, we won't have much to say on the specifics of it, if anything. U.S. Attorney, FBI, I believe, are both involved, and I'm sure our Attorney General is or will be involved. So this is not specific to your question, and again, you'll permit us for not being able to talk specifics. But as a general matter, if somebody is trying to hoard or price gouge in this hour of need, they deserve that special place in hell. So that would I just say that as a general matter. I'll stay on, John, and just address your last point. The answer is yes, we do get concerned about that, which is why every single day I say to folks, while it's better than it was, we're not out of the woods. When you lose 307 precious lives today, or we announced that today, and while the hospitalizations have flattened, Judy, but they're in the 7,000 to 8,000 people range, right? And the ICU patients are, consistently 1,800 to 2,000, and ventilator use, while it's better, is still high. And the map looks better. We get all that, but we are not out of the woods. And the great news is, and this is the one part of that poll that came out the other day that I really latched onto, not only is there enormous compliance, including, as was pointed out to me, by people who, by definition, many people who have lost their jobs, who support a lot of the closing down, even in the teeth of enormous personal financial pressure, which is just extraordinary. But the part in particular that I noticed was, and I think my numbers are right, 11% think we've gone too far. 23%, more than double, think we've not gone far enough. So I would just say to folks out there, you're doing an extraordinary job. We have clearly made progress, both up here and more importantly, far more importantly, with you all. But you got to stay at it. We are not out of the woods yet. Maybe go to Matt and then Judy or Christina on when do you see asymptomatic testing. But Matt, a particular comment, if you could, about the $1.8 billion that we had thought we were in the clear on, and now we're actually believing we're not in the clear on.
Sure. So going back more than a month ago, the governor's been calling for block grant direct cash assistance to states, given that the mitigation efforts that he put in place are going to result in dramatic declines in revenue as well as increased costs to confront the crisis. Roughly, I think it was 29 days ago, they passed the CARES Act. It had a coronavirus relief fund, $150 billion for states and localities. The state was due roughly $1.8 billion. There were several counties in the state who were due an additional $1.6 billion. Yesterday, Treasury released guidance on how we can use that money, and essentially it boils down to you can't use it on anything that you budgeted for last year. Well, we have expenses that are new. A lot of those are reimbursable through other federal programs. So this money that's now sitting in an account, literally billions of dollars, if we can't use it for anything that was budgeted for last year, in a very strict interpretation, we're going to have to return most of it. So an example would be education. We've budgeted for education for a year. We're paying for teachers to be teaching students and children through dramatically different means, remote learning, delivering school lunches, doing things that was never envisioned a year ago. Under Treasury's guidance, we can't use this funding. So as we're falling off a fiscal cliff, this money that was put into the CARES Act as a recognition for what states and governors have done to address the pandemic is now of little to no use to us. So we've been actively working with the federal delegation through the night with the administration. I think the governor was actually the first governor to call leadership about this, to make it clear to them that this guidance doesn't work. It doesn't reflect the realities on the ground. And you're going to put at risk thousands and thousands of hardworking public servants who are, taking care of critical jobs on a daily basis if they don't fix it.
By the way, as Matt knows, part of the exchange I've had on my machine here has been with Speaker Pelosi, who's been extraordinarily strong on our behalf on this. Who would like to, this is our last comments and then we're going to break. John asked about when do you see our doing asymptomatic testing. I think we answered the narrow question yesterday that we need a waiver on the FEMA sites, but they're now only 2 of 86 sites, and obviously you've got Rutgers exploding here. Judy, you want to address that?
I can't give you an exact date, but I can tell you that we meet regularly and we're developing a testing task force. The test is the first step. The second is identifying vulnerable populations, priority populations, and then going into what percentage of the population do we need to test to make some that is significantly, statistically significant, and then make decisions from the results of those tests. And the more difficult thing is the contact tracing methodology, which is pretty clear through some of the work that is done historically and traditionally by local health departments, and how many contact tracers we need to follow up credibly with the results that we're getting. We've met actually this morning on this, and we should have an outline, I would hope, next week of how we expect to approach this, and then fill in the blanks for how we get the contact tracers and how many we actually need. I don't think I'm revealing any information that's secret, but the work that our communicable disease service has done shows that we need 81 contact tracers for every 100,000 population. So you can figure that out. If we do testing for everyone, how many we would need. But we will have a plan.
I've already masked up here, so forgive me for that. A couple of things. One is I've gotten from some good friends complaints that we're using plastic up here, and we got enough of a problem with plastic in the world already. So Mahan, maybe you can help us get to a better place on that. I think as I said a few minutes ago, we're going to have sort of the broad principles outlining of how we see this sort of reopening process going by Monday, and I'm not sure it'll be by Monday, but part of that is going to be at least the broad outlines of the healthcare infrastructure we're going to need as it relates to testing, contact tracing, isolation, quarantine plans, et cetera. And I just say in the meantime, folks, you have done an extraordinary job. Please continue to do it. That is the one big weapon we have that gets us through this with fewer casualties, and we've already lost too many precious lives, fewer hospitalizations, and faster as opposed to slower. I want to thank the Commissioner Judy Persicelli, State's epidemiologist Dr. Christina Tan. I want to thank Colonel Pat Callahan, and our featured speaker today, who I think has given us an enormous amount to be proud of, and his team over the past number of weeks, and you saw some of it in living color today. Chancellor Dr. Brian Strom, there's big things going on at our flagship university, and they are not just part of the Army fighting this, but they are a big part of the Army fighting it, and they're going to play, I think, an even bigger role as we go forward. So to each and every one of you, thank you. We'll be back with you tomorrow at 3 o'clock.